Hello, this is the overview of the modified checklist for autism in toddlers, or the MCHAT tool that we will be using in our class for one of our assignments to screen toddlers. Just a quick overview of the tool. It was originally developed in 1999 by a team of psychologists. And the MCHAT that we're using in our course is actually an abbreviated version of the original checklist for autism in toddlers. And it was modified. The original tool included 9 parent report items as well as an observational section where a healthcare provider or other professional observed the child's behavior. So the MCHAT tool that we're using actually took out that observational section and includes 9 original plus 14 additional parent report items for a total of 23. And also using this version, it can be scored rather quickly, and the authors boast that it can be scored actually under 2 minutes. So quick and easy and convenient to use. So the goal of the tool is to screen for any autism spectrum disorder. It's not specifically limited just to autism. So any child that scores with a concern on it potentially would warrant further referral and evaluation, but it's not sensitive just to autism. So something to keep in the back of our minds. Again, it is a screening tool, and therefore it is not in and of itself diagnostic. So any child, again, that screens positive on it doesn't necessarily have or won't go on to be diagnosed with an autism spectrum disorder, but it's a screening tool. So, and it was designed to be used by healthcare providers and other professionals. Now, the MCHAT tool has been validated in several studies for screening toddlers between the ages of 16 to 30 months. And it has not been validated for use outside of this age group. So when we're screening children for your assignment, please make sure that you're screening a child that falls within the 16 to 30 month age group, as well as if you incorporate this tool into any of your practice settings. Keep that in mind. It can very easily be incorporated and used at well-child checkups. Certainly parents can fill out the tool in the waiting room or once they've been checked in and they're waiting for the provider to come into the room. But it can also be used in other settings as well where there might be concerns, or you might want to do screening such as school-based clinics or even preschools, early childhood development centers, those types of things. So, and again, it's not diagnostic, but yet it's a tool to screen, and it assesses the potential risk for having an autism spectrum disorder. So the tool that we're using in this course, the MCHAT, has 23 parent report items. So it's a questionnaire that the parents would fill out prior to their appointment. And the parents do need to answer each of the items on the questionnaire. And as they're answering the items, it's very important that if there's a behavior that their particular child exhibits but maybe has only done it once or twice, it's extremely rare, then it's recommended that they answer the question as if the child does not exhibit that particular behavior. And this just shows you the screening tool itself, which there is a PDF of this on your Blackboard site, so you can download this to use while you're doing your assessment and assignment for the course. There are 23 questions here, and the directions are on the top. And again, just reminding the parents that if the child really rarely exhibits this particular behavior, then to answer it as the child does not do it. So now when you're looking at scoring the tool, again, the MCHAT has to be used in its entirety. There isn't any research that shows that the tool is valid if we just were to use, say, the first 10 questions or a subset of questions. So again, parents need to answer the tool in its entirety. So when you're scoring the tool, the child will fail their screening when they fail 3 or more out of the total 23 items, or if they fail 2 or more of the critical items, of which there are 6 of. And the critical items include numbers 2, 7, 9, 13, 14, and 15. Now, there is a scoring template and instructions available at the website here on the slide. There is a set of scoring instructions posted to Blackboard as well, but the scoring template is actually available on that website, and you can download it and copy it onto an overhead transparency, which then you can lay over the test. And if you were doing these routinely as part of well child exams or in a clinical setting, it would be useful to have that tool to be able to score things rather quickly and facilitate that. So that is available. This just shows you the MCHAT scoring instructions here. So again, you can see when they fail 2 or more critical items or any 3. And below on this chart here are the failed responses. So if they have any of these responses for any of those items, then that item is considered a failure. So, and again, not all the kiddos who fail the checklist will meet the criteria for diagnosis. So just want to drive that point home. So just a few additional things to consider when we're using the MCHAT tool. The goal of the tool overall is to maximize the sensitivity. So, obviously we want to screen children and have a high sensitivity rate where we are going on and then having children diagnosed with one of the autism spectrum behaviors. But however, because it's designed to maximize that sensitivity, there's a potential for high rates of false positives. So what that means is not all the children who score at risk for an autism spectrum disorder will go on and actually be diagnosed with one. So that's where we need further evaluation if they do have a failure with this screening tool. So now, you don't have to do this as part of your assignment, but if you're in a clinical setting and you do use this tool, they actually have on their website here below a follow-up interview if you do have any failures, which uses the tool again, but it's a longer version where it actually has more questions, and you would actually probably do this in a room with the child and the parent and the provider. So again, you don't have to do it as part of your assignment, but it's something to be aware of, because you certainly wouldn't necessarily want to refer every child that failed this screening without asking a few more questions and digging a little bit deeper and observing the child yourself. So, and then again, this follow-up interview is designed to reduce those overall false positive rates. So if you do have a child that fails the follow-up screening, or a child that you're concerned about, you want to think about referral and further evaluation and who you're sending them to, and who you're sending them to and which child you're going to refer. So again, anybody with a failure, and again, you need to look at that a little bit closer to see, is it truly a failure? Are there any other red flags that perhaps are going up? So again, as the screening tool is not necessarily always specific just to autism, it may raise some red flags for some of the other developmental delays or concerns for other developmental disorders outside the realm of autism spectrum disorder. But again, if there's red flags, the best thing to do is refer for further evaluation. So, and certainly anytime you have a child that you're concerned about, another professional is concerned about, whether that's somebody, school nurse, anybody in another setting that's concerned about, or a parent that's concerned about them, you certainly would want to refer them on for further evaluation. Now, another thing to keep in the back of your mind if you do incorporate this tool into a practice setting is that the authors are continuing to do research using this tool and looking at it. So there may potentially be further revisions of the tool down the road, and it's just something to keep in the back of your mind to double check every once in a while to see if there are any revisions. And also on the website, which is on the reference slide, this tool is available in numerous languages. So if you're working with populations that aren't English speaking, and even beyond Spanish speaking, there are several versions in other languages available to you for use. Now this is just a simple little algorithm that I pulled off of the firstscience.org website, and it talks about using the tool and when to refer and whatnot. And you can see that's a pretty good algorithm there to sort of follow and look at when you're using this tool, particularly if you have kiddos that have failures. And then here are the references. The first reference is the website for the MCHAT. There's a multitude of information on there, so you can certainly check that out. It also has the tools, it has the scoring guides, as well as the template you can use to overlay to score the MCHAT. Firstscience.org is just another website that has a lot of information about screening and recommendations, as well as information for parents and healthcare professionals as well. And then I've also just included one of the research studies looking at the MCHAT tool and using it as a potential screening tool. So thank you very much.